Dr. Nadeem Qureshi heals. Other physicians are stressing you really need to take coronavirus seriously and understand the long-term impacts of it. News 4's Chris Negus live for us tonight detailing the doctor's just incredible story of survival.
Claire, it really is. This is a story about a pediatric physician that beat the odds. Now, he doesn't know exactly where he contracted the virus, but he does know it nearly killed him.
And I told my wife that this is a profound weakness. I've never experienced this before.
After returning to St. Louis in late March after teaching a course overseas, Cardinal Glennon physician Dr. Nadeem Qureshi was diagnosed with coronavirus.
And I remember on the 26th of March, I really felt that day so weak and dehydrated that I felt that this is the day I need to go to the hospital.
Within hours of arriving at Barnes Jewish Hospital, the 55-year-old doctor's condition got worse.
They decided to intubate me 6 hours later after I reached the hospital.
So you were put on a ventilator?
Yes. I was on a ventilator for about 21 days.
Wow.
Yes. They called me the medical miracle. I survived. I was on the ventilator for 21 days.
Otherwise healthy, Qureshi says he didn't have any pre-existing health conditions.
I don't have hypertension. I don't have diabetes. I've never been to the hospital except to work. I've never been admitted. I've never had surgery.
We can't predict who gets infected with the virus and gets really, really sick and potentially loses their life.
SLU care physician Dr. Michael Lim says society needs to respect the virus and understand its effects, including long-term impacts that can be significant even after recovery.
There's issues in terms of how long COVID can last in somebody and what the long-lasting effects are. And so certainly we're beginning to understand that there's some lung damage that can be irreversible.
Since I've come home, I've done rehab almost every single day.
After 40 days in the hospital, Qureshi is eager to get back to work. He's also encouraging the public to take precautions. He's lucky he can talk about it, despite having no memory of his time on the ventilator.
I did not have any idea of concept of time at that time. I did not know what had happened to me.
So you lost a couple of weeks of your life and have no memory of it?
Absolutely.
You nearly died of this.
Yes, absolutely. No question.
Dr. Lim over at SLU told us the best precautions really are the social distancing and the face mask. And Qureshi also believes face masks are very beneficial, even if the people around you aren't wearing them. He says that's because it would prevent something that he describes as viral overload. So if somebody sneezes or coughs and they're not wearing a mask, but you are, it might protect you from that overload. Really the best precautions at this point. Steve?
Chris, that is quite a story he has lived to tell. Thanks.